Hello everyone, my name is Dr Parissis and today I'm back to discuss when you should accept hair loss. I'm sure everyone knows the classic fact that 50% of men by the age of 50 will experience hair loss, 60% by 60, 70% by 70 and so on. And amongst these men, you kind of have one group of men who strongly accept their hair loss and go with it, and then you have another group of men who fight it to the very end and will do everything possible to resist hair loss. But really I wanted to discuss that other group of patients that I've spoken to a lot, and these are patients who've experienced some hair loss but they're not really sure what to do. In a way you could say that they're kind of at a crossroads of entering those two categories. You know, to the left is accepting hair loss and kind of accepting nature, allowing nature to run its course, and then to the right is resisting it and fighting it to the very end. So there's a lot of patients and people that I've talked to that don't really know what to do. So this video is really for them. It's really to help them decide and to help them be a little bit less indecisive about their approach to hair loss. If you are one of these people, I want you to ask yourself this: have you actually lost any hair? And the reason why I ask this is because a lot of people are worried about hair loss, naturally. They might have a brother, a father, or even a friend who's experienced hair loss, and you know, it forces someone to look at their own hair and to worry about it naturally. A lot of patients, for example, are very worried about their normal natural shedding, and because they're already worried about hair loss, they kind of attribute what is normal natural shedding to male pattern baldness, which is not necessarily the case in a lot of patients. So really the main definitive approach to working out whether you have male pattern baldness is to look at photographs. If you're 25 years old, most people will have photographs of them under the age of 18, 17, 16, 17, 99% of patients will not have experienced any male pattern baldness at that age. Really, we can use age 16, 17 as a baseline. I want you to look at photographs from when you were 16, 17 years old and compare them to now. Look at the rate of progression. Look at the overall mass of the hair, the volume of the hair. Look at the hairline specifically. Is there any recession? Is there any kind of natural maturity where a lot of men will have a kind of a natural largening or elongating of the forehead? That might not necessarily be male pattern baldness, but look at the hairline. Is there any widow's peak? Is the hair on either side here, is it particularly thinner than in the middle? Is the overall bulk to the hair less? What about the crown? Is there thinning in the crown? You'll be able to tell from looking at photographs whether or not you are really undergoing male pattern baldness. Let's say that unfortunately you were able to see some differences in your hair now compared to when you were 16, 17, 18 years old. Now I want you to ask yourself, how much hair have you lost? And over how long a period of time? Because this gives us an idea of your rate of progression of hair loss, and it will help you to predict where you might be in around about 3 to 5 years. So the first category of people might be those people who have lost a little bit of hair over a very long time. For example, you're 35 years old and you've got a kind of natural recession of the hairline. That is the only difference really that you see between you now and when you were 16, 17 years old. Let's say you're in that category. So your rate of hair loss is relatively slow. Now you really have two options here. You can either accept your very slow rate of hair loss, and there's a lot of patients I know that kind of enjoy having a somewhat mature hairline. It can give a kind of a manliness, if you like. Some people are very happy to have a more mature, slightly receded hairline, and because their rate of hair loss is slow, they know that it's not going to get much worse anytime soon. So you can do nothing about it, or you could do some research into some medications to stop hair loss. For example, minoxidil, finasteride. You can go on Google Scholar, look at some research papers, specifically randomized controlled trials are the ones you want to target, and look at the safety and effectiveness of these medications. The second category of patients is those who have lost a lot of hair over a very short period of time. It doesn't take an expert to work out that if you're in this category, your rate of hair loss is very fast. And so that means that within 3 to 5 years, you can expect, if you were to do nothing about it, you can expect to be almost partially or fully bald, essentially. If you're in this category, I want you to ask yourself this: if you were fully bald in 3 to 5 years, how much would that affect your confidence? Would it affect your self-esteem? Would it affect your view of yourself? Would you be less confident in certain scenarios being bald? If you feel that this wouldn't affect your self-esteem or your confidence, then that makes your life much easier. I know that Bald Cafe and other channels are doing an excellent job at promoting self-acceptance of balding, and I think it's a wonderful thing because realistically, the main goal is feeling comfortable in your own skin. You might also have shaved your head or done a buzz cut in the past and actually quite like the look of it. There's a lot of celebrities, of course, that rock the bald look. It can be a very enjoyable look for a lot of people to have. If you think that it would affect your self-esteem or your self-confidence, then ask yourself one more question. What are you prepared to do to prevent yourself from being fully bald? Where would you draw your line at? Would you draw your line at taking vitamins like biotin, for example, to support hair growth? If you've lost a lot of hair in a short period of time, these are unlikely to help, realistically. They'll support hair growth, but they won't really stop further loss or regrow any hair. Are you going to draw the line at medications, which could potentially have their own side effects? Are you going to draw the line at hair transplant surgery, which has its own risks and can be a financial hit for a lot of people as well? The only way to answer this question is to do more research. If you're unsure of where you want to draw the line at, then you need to do more research. You simply don't know enough on the topic, essentially. You need to be more informed. This is a decision that might be lifelong. Some people take minoxidil for the rest of their lives, so it is a lifelong decision. For medications, I encourage you to go on Google Scholar, look up the medication that you're interested in, for example, finasteride and minoxidil. Look for some research papers, specifically target those randomized controlled trials. They'll say it in the title. Look at those and look at specifically the conclusions. You don't need to read the whole papers. Specifically the safety of the medications and the effectiveness of the medications, and try to decide where that kind of fits into your expectations of those medications. The second thing that you might want to consider is hair transplant surgery. If you're interested in that, what I would do is I would go to Dr. Bloxham's page, who has a number of videos discussing hair transplant surgery, pros, cons, results. This will give you, again, more information on hair transplant surgery if that was where you wanted to draw your line. So the next category of men who have experienced male pattern baldness might be those who have experienced a lot of loss, but over a very long period of time. For example, you're 40 years old and your hair has been gradually being lost over the last 20 years. So this indicates really that your rate of progression is not particularly quick, it's slow, steady, yet persistent. And so really it's not going anywhere, it's probably going to continue. Once again, if it doesn't bother you, try to accept it. If it does bother you, think about where you're going to draw your line. If you've lost a lot of hair, maybe medications are not the right thing for you. They're mainly good for keeping the hair that you already have rather than regrowth. Some people have reported regrowth with certain medications. They mostly benefit at keeping existing hair. And once again, try to learn about the pros and cons of hair transplant surgery if that's one of the routes that you'd like to consider. What about if it has been a little bit over a short period of time? For example, let's say you're 30 years old, you've had a full head of hair, no loss up until age 29, and over the last year you've noticed that you've lost more hair. Now, with these people, it's very difficult to comment on the rate of hair loss. It's almost like we don't have enough information. So what I might suggest for these people is to watch and wait. Because you haven't lost that much over the short period of time, it's likely you've got some time in the tank. You don't need to act straight away. It's not as much of a matter of urgency. And so we can watch and wait, see just how sensitive your follicles are to DHT over, say, the next 6 months to a year. And if you lose a little, then we can, think about options then. You can, of course, inform yourself about medications, treatment options available to you in the future, should you need them. But really, it's not as much of a matter of urgency, and so watching and waiting might be the best approach for you. So in conclusion, the most important thing that I say to patients all the time is that you need to feel comfortable in your own skin, happy and stress-free. And however way you can do that is the best way to do it. So if you are very, very comfortable, very happy with being bald or with losing your hair, then this is the best approach for you. If you're not, there are things out there. We still have work to do in the hair loss community. But really, I wanted to make this video for those people who are really indecisive. They're at the crossroads, they don't really know what to do. And I hope that this video kind of pushed them in one direction so that they can get out of that stressful, indecisive spot. But I hope that it helped. As with a lot of other things in life, a lot of the time you can be very stressed because you don't know which decision to make. In this case, with regards to accepting hair loss or putting up a fight. Once again, I'm Dr. Parissis. I work in London, UK. Thanks for watching.